Hey everyone, welcome to Easy Nursing. This channel is dedicated to making NCLEX reviews, general nursing tips, and practice question videos. Today we're going to be talking about Cushing's versus Addison's disease. So what is Cushing's and Addison's? What we're talking about is too much or too little of the adrenal cortex hormones. If you didn't know, on top of the kidney is the adrenal cortex, and it produces hormones. So when we're talking about these diseases, one's going to be one that is too much. This is known as Cushing's. And one is going to be known as too little. And this is Addison's disease. Now, while we're looking at this picture, I want to go ahead and explain you something. So how does this work? The brain, inside the brain, you have the pituitary gland. Kind of looks like a globe of garlic. Here, it produces ACTH, which is then released to the adrenal cortex. Then the adrenal cortex produces its hormones. And we'll talk about those hormones in a minute. Now, when we're talking about these diseases, I told you the end result is you have too much or too little of these hormones here. Now, there's two causes for these. One cause is the adrenal cortex is just not working right and it's producing too much or too little. The other cause is that you have too much or too little ACTH, and then the adrenal cortex is not able to produce enough, or it's producing too little. So there's two causes. Either something's wrong with the pituitary gland or the adrenal cortex. Either way, you're going to have too much with Cushing's or too little of Addison's. So what is Cushing's? I told you, high levels of the adrenal cortex hormones. What are these hormones? You have aldosterone, cortisol, and the androgens. Now, what is aldosterone? Aldosterone tells your body, let's hold on to salt and fluids because we want to maintain our blood pressure. Now, in order to hold on to salt, it does expel potassium. All right, what is cortisol? Stress hormone. This tells the body produce lots of glucose into the bloodstream and lots of fight or flight. And the androgens are sex hormones. So I told you Cushing's is too much. Addison's is too little. So you're going to have the opposite. Too little aldosterone, too little cortisol, too little androgens. Now let's talk about what this looks like. But before we get to that, what causes this? Well, with Cushing's, you could have a problem. Pituitary gland is producing too much ACTH. You could have the adrenal cortex is producing too much of the adrenal hormones. Those are two main causes. Other causes, I told you they have way too high stress hormone. That stress is called is a steroid. Well, if these patients are taking long-term steroids, it can cause them to have Cushing's disorders. Also, cancer, either to the adrenal cortex or to the pituitary gland. Addison's, well, it could be cancer to the pituitary or adrenal glands. It could be that the adrenal gland has been removed surgically, or the pituitary gland's been surgically operated on. Those are some ones there. Now, if a patient's on steroids long term, like one of these patients, and they stop cold turkey, the steroid withdrawal, not enough steroids, they'll look like Addison's. And the two other main causes is TB and histoplasmosis, which both can be respiratory infections, or idiopathic, meaning even an idiot couldn't figure it out. Idiopathic, it makes us look like idiots. Nobody knows. Idiopathic means it just happens. There's no medical reason that they found. So, what's it look like? Cushing's is too high aldosterone, too high cortisol, too high androgens. Well, aldosterone holds on the fluids, fluid retention, hypertension. They also hold on to salts, and they expel potassium. Well, low potassium, high salts lead to weakness. Cortisol, stress hormone. And what you'll see is that they are going to have high stress, high glucose. They're going to look like a diabetic. High sugars, at risk for infection, and poor wound healing, like a diabetic. Also, the stress hormone tells the body to hold on to fat in some bad places. You're going to have fat around the abdomen, fat and fluid around the face, and you're going to not have good protein rebuilding, and so you'll have thin extremities and at risk for wounds and poor healing. Okay, this is why you should not be stressed, or you're going to start looking like one. Androgens are too high. This can cause women to have hirsutism, which is like you see the bearded lady. Let's take a look real quick at what this looks like. Cushing's, you got the moon face, you got the buffalo hump. These are two you're going to see right there on your test. Please circle this. buffalo hump, and moon face. You also have fat around the abdomen, thin extremities, at risk for wounds here. And you can see these striae on the skin because they have poor proteins and all the stretching from all the weight gain. Also, you can see the bearded lady here. Now let's talk about Addisons. You're going to have too low aldosterone, too low cortisol. And so what happens, you're not holding on to fluids anymore, you're actually pissing it out. And so you'll have severe hypotension, dehydration, and you can have some dizziness. With low cortisol, so you don't have enough of the stress hormone, you're going to have the low glucose levels. You're going to have high potassium, low sodium. Whenever you have an abnormality of potassium and sodium, you're going to see weakness and fatigue. And they're losing fluids, and so they're going to be having some weight loss. Now, I told you Cushing's, moon face, buffalo hump. Remember it. Well, with this, hyperpigmentation. It's important because teachers like to hold on to this stuff. You're going to be very tan looking. And so it has to do with the ACTH, and it affects pigments of the skin. So let's see here. We have weight loss, low blood pressures, especially with changes in body position, low blood sugars, hyperpigmentation, and you're going to have weakness. What are some labs? Okay, Cushing's, changes in ACTH. You'll see this both Addison's as well. So I told you there's two causes, either pituitary gland or the adrenal gland. So if the problem's the pituitary gland with Cushing's, you have too much adrenal cortex hormones because the pituitary gland is producing too much ACTH. In that case, you'll see high ACTH. The other option is you have high adrenal cortex hormones for no reason. It's not because of the pituitary gland. If that's the case, the pituitary gland is going to say, you know what, we need to stop producing it. It'll drop its ACTH down to nothing, and you'll see low ACTH levels. That's how you can diagnose where the cause is for Cushing's. With Addison's, you're going to have the same thing, except for it's low adrenal cortex hormones. So if the ACTH is high, that means the pituitary gland is working properly. It's not the problem. It's just that the adrenal glands are not responding. They're the problem. The other option is you have low ACTH, and the pituitary gland doesn't realize this, and it just stays low, and then you have low adrenal cortex hormones. All right, back to Cushing's. Cushing's, you have high cortisol. So I told you you'd have high sugars and a low white blood cell count. Because of the aldosterone, you're going to be holding on to sodium, and you're going to be losing your potassium. Addison's is the opposite. You're going to have low cortisol, leading to low glucose levels, and you're going to have low sodium, but you're holding on to your potassium. Let's talk about diagnosis for Cushing's versus Addison's. Well, with Cushing's, you want to check the cortisol levels. If they are high via salivary or urinary collection, it's a sign of Cushing's. Also, you can do an X-ray, CT, or MRI of the brain and the adrenal glands to see if there's a tumor or some sort of abnormality. With Addison's, you can still do the X-ray, CT, or MRI to look at the adrenal gland and brains. With them, instead of checking cortisol levels, you'll do the ACTH stimulation test. What this does is they're going to give you synthetic ACTH. If the pituitary gland, let me rephrase this, if the adrenal gland is working properly, when they get that sudden burst of ACTH, their adrenal hormones are going to go up. If it's not working effectively, then they're not going to change at all. So after this test, they'll determine whether the problem is the pituitary gland or the adrenal gland. And because of high potassium, you're at a very high risk for heart dysrhythmias, more so than you would be with low potassium. So with Addison's, you definitely want to monitor the heart. Medical treatment for Cushing's and Addison's. Well, Cushing's, you have too much steroids, so you want to taper them off any steroids that they may be on. Too much, if the problem's too much ACTH, you want to give them ACTH inhibitors. They may need radiation to any cancers on their pituitary gland or adrenal gland, and they may need surgery to the pituitary gland or the adrenal gland. Also, you can give them aldactone. This is going to be a diuretic to help them get rid of the fluids, but hold on to potassium. That's because it counteracts the aldosterone. With Addison's, they have low fluid levels because they are just losing their fluids, so you want to give them IV fluids. They have low steroids, give them IV steroids. They have low glucose, make sure they get IV glucose or make sure they're eating. They don't have enough aldosterone, you can give them fludrocortisone, also known as Florinef, to help them also to hold on to fluids. And then if their potassium's too high, this has to do with aldosterone. These patients are at high risk for cardiac dysrhythmias. So these are some quick tips you can do until the patients get better. You can give them Kexalate. It's going to help them to poop out the potassium. You can give them insulin. What this does, insulin, you know how insulin tells the cells to absorb sugar, and that's why you see the blood sugars drop? It also will tell them to absorb potassium, and then their potassium will drop. And it's not going to affect the heart if it's in the cells. If it's just running around freely in the blood, you'll see heart dysrhythmias. Calcium gluconate is like a shield. It just coats the heart and lets it know, hey, don't be affected by potassium, and keeps it protected. Real quick, medical emergency, Addisonian crisis. You don't really see a Cushing's crisis, but Addison's you do. It's typical treatment I just told you about, just very quick. So they need fluids immediately. They need steroids immediately. They need, their potassium is through the roof, and they need Kexalate, insulin, calcium gluconate, or sodium bicarb pretty quick. Also, you can give them loop or thiazide diuretics to pee out their potassium. Now, of course, if they're peeing out their potassium, I told you, definitely make sure they get IV fluids. They have low blood sugar, make sure they get their glucose. And they may need EKG or continuous heart monitoring. Let's real quick, nursing tips, Cushing's and Addison's. Well, both of these you need to monitor their ins and outs because you want to make sure how much fluid is in their body, how much are they losing. Now, Cushing's, these patients look kind of like a diabetic, so you want to watch them for risk of infection and wounds. Also, you want to make sure they get high potassium, low sodium. Big thing about Addison's, this is going to be a lifelong treatment, and so they're going to need to be compliant with their medications. Take your steroids every day as you should. Don't suddenly stop. If you can't afford it, talk to your social worker. And just monitoring to make sure they get enough treatment, but not too much where they're going to start looking like these guys over here, the Cushing's patients. So that's the video. Hey everybody, thank you for watching Cushing's versus Addison's. Please subscribe to the channel if you like this video. Comment below and let me know what I can do to do better. Anyways, this is Easy Nursing.